Hi, this is Frank with a Frank Opinion. It's been a while, but I have, I hope, some important digestible information for you today. The controversial Medicare for All issue. The attempt to create, like the rest of the world that's sane and humane, a health coverage program from birth to death that includes hospitalization, clinic, doctor's visits, dental, hearing, vision, mental health, rehabilitation, everything that you can possibly put into a comprehensive health package. And what I want you to take away from today's presentation, if nothing else, is 4%. I hope you dream about 4% tonight. I hope you wake up and say inadvertently 4% and not know why. Well, hopefully it's because of this presentation today. What is 4%? Why do I have it here? When Bernie Sanders came out with his Medicare for All bill, he also had an options for financing Medicare for All. It includes 10 to 12 financing options, different tax options. The first two are 7.5 payroll tax on employers, excluding the first $2 million worth of payroll. So that's not really small companies that would be affected by that. That's pretty large companies. And that would produce around $390 billion a year in terms of the projection in that paper. The second one is a 4%, remember, sleep with that tonight, tell your friends, next door, 4%, is the health tax on employees. After they take away their standard deduction. So it's their annual income minus their standard deduction times 4% would give you the total cost for that individual or family for the entire year. No deductibles, no co-pays, no co-insurance, providing absolutely comprehensive health care. So let's take an example. Today I talked to 3 people. The first one, while I was petitioning for my favorite congressional candidate that will hopefully unseat my current congressman, is Charles. Charles is a chiropractor. He's in Little Neck. I've known him for years. And for years he's had a issue trying to figure out his annual income without his accountant. Well, we took a crack at it. Last year he figured he made, after business expenses, somewhere around the figure of $124,800. We chose the $24,800. He's sure of the $100,000. He's pretty sure that it's going to be around this after business expenses, because it makes it easier to figure out what his cost will be for his health care for himself, his children, etc. So his income, $124,800 minus standard deduction of $24,800. That's actually for this year. Last year it was $24,400, but let's not quibble about the extra $400 there. That gives a remainder of $100,000 on which he would be assessed a health tax of 4%. Okay? So what would his total expense have been last year to provide health care for his entire family, including dental, hearing, vision, hospitalization, doctor's visits, etc.? It would have been $4,000. What did Charles shell out last year? His monthly premium is $1,300. That's actual. Times 12, $15,600. But he also has a deductible of $4,000 plus $50 copays. So his total bill last year was $19,600 plus whatever he spent in copays. Now I think you'll agree with me that that is a lot more than $4,000. So Charles, who works hard, has 2 small children, would have saved 80% on his health care cost. I spoke to 2 other individuals today. One is a personal trainer, not married, single individual. I didn't want to press him. I don't know him as well as Charles. Charles is a friend of how much he makes. When I told him that his health cost would be only 4% of his income after standard deduction, his jaw almost dropped to the floor. Another person who I know for a few months, he manages a paint store on Bell Boulevard here in Bayside, Queens. He has a wife and 3 kids. I took a guess at what his income might be, $60,000, minus the $24,800, leaves $35,200, on which he would be assessed the 4% health tax. That comes out to $1,404. He's already paid out over $8,000 in health care costs, insurance plus co-pays and deductibles for his family on a $60,000 salary. I think this is a no-brainer. Only the 1% in the United States, those making $750,000 household income, would actually pay more in this particular funding scheme than they pay now. And maybe not even then, because platinum insurance policies within the districts that I live in are from $36,000 and up, those that don't have a copay and a deductible. They're extremely expensive. The 1%, can the 1% afford to pay more? 99% of Americans for sure are going to see a savings under Medicare for All, the financing scheme. One last point. There's been many studies that have come out with what would it cost in total dollars. If we look at what we already spend on health care within the federal government, if we look at the savings that we would gather in moving to a Medicare for All program, the 2 first options under Senator Sanders' options for funding Medicare for All come up to $740 billion, only $33 billion less than the current most recent Yale study produced by Lancet that said what we need is $773 billion more. Awfully close. So when you see commentators, MSNBC, CNN, Vice President Biden, and a host of other people misinform you, please take them to task. I think you'd rather pay 4% in terms of your net income minus standard deduction than the outrageous cost that you're paying now. For my own family, we would have paid $5,808 as opposed to almost $18,000 in health insurance and related costs last year. Remember, 4%.